Hello, it's Dr. Bettina here. I'm answering a letter this week from a parent whose daughter is 14. She says she is struggling with her mental health and they were on a waiting list to get some talking therapy. She says that she just wants to sleep all the time and it's difficult to get her to talk about anything or get motivated. And what can she do in the meantime? So obviously, I'm not sure exactly what the mental health difficulty is here, but it sounds a bit like it's low mood or depression, where sleep and motivation is often impacted. We also know that in the teenage years, teenagers can sometimes shut down their conversation with parents, and it can be quite hard to reach them. So, what I'm going to do is start with 5 tips about how to communicate with a young person that's not keen to talk or who's quite shut down. Then I'll think a little bit about low mood and depression and what we know helps. And then I'll finish just with a thought about how do we know when something is a really concerning mental health difficulty. So, the 5 tips. First of all, build communication slowly and expect very little at first. So, what I would suggest is that you literally accept even the tiniest scrap and don't ask for more. So, go in with the intention to try to communicate, and then just take what they give you and be glad with what they gave you. Don't say, "Oh, well, can't you tell me more?" or put pressure on them. You just want to say, "I'm so glad you told me whatever you say." And within that you have to make sure that you are careful with your own nonverbal communication. Teenagers are very sensitive to nonverbal cues. So your tone of voice, your facial expression, your body language, you don't want to give a huge response or be overly emotional towards them. Just take those tiny scraps that they give you and build communication slowly. Number 2, don't be scared to talk about hard emotions. Sometimes, as a parent, we love our kids more than anything in the world. We can be biased to wanting to shut things down when they tell us something difficult. But if we give them the message that it's okay, you can talk about hard things with me, then they can process it and they process it in the space that you give them in the conversation. So try to be brave and listen courageously, even when they're talking about something difficult. The third thing is really choose your timing very carefully. You want to read their cues and be really responsive, finding out what's the best time for them to speak. It's not really about when you're ready. I think we're all very used to reading babies' cues, aren't we, in terms of what they need? But we really need to do the same thing when we have a teenager who is struggling. Sometimes it's easier for a young person to engage in conversation when you're doing an activity together. Maybe when you're in the car, you might be drawing together, you might be playing a computer game together, something like that. That might be the easiest way where there's no eye contact. In a car journey, we know that there's an end coming. So those are good times to maybe attempt the conversation. And don't be put off. Number 4 tip, don't be put off if you try and you get nowhere. If you communicate your intention to help and they really shut you down and say, "Oh, stop it," then don't be put off and think, "I'm never going to get through." You might just have to keep trying. You could say something like, "Do you know what? I can see it's not a good time for you now, but know that I'm here whenever you want to talk." Or you might say at another time, "What can I do to make it easier for you to talk about what's on your mind with me?" So those are just questions that might give them the opportunity to open things up in the future. And 5, so important that you get support from partners, family, or friend. It's a really, really hard situation to face. And I have worked with many parents where they're so frustrated because they really want to be able to talk openly with their young person, and they're having difficulty. So I hope those tips help. Just a few thoughts on low mood and depression. There are just 3 things I want to talk about here. One of the things with low mood and in a young person, in anybody actually, is that we know that motivation is a problem. When we feel low in our mood, we don't feel like doing anything. But what we know in terms of what helps is that counterintuitively, the way to help with motivation is to get the person doing things. It's not that we sort the mood out and then the mood will enable us to do things. It tends to be the other way around. We have to get the person actively doing something, and that will shift their mood. So activation, or getting them doing things, is really something to focus on. This should be something small. Always start small and celebrate when you have a win, something that matters to young people, something that, is within their values, something that they really care about. And I would just aim for one thing a day to begin with. If you can add any social connection into that, particularly if there's a teenager, that will really help, because we know that social connection is crucially important for young people. The last thing, the third thing to think about with low mood and depression is sleep. So again, we know that there are problems with sleep regulation in young people and people who struggle with depression or low mood. So try your best to get her in a good sleep pattern as best you can. I always say it's a really good idea to try and get screens away from them at night, and using the daylight to help release melatonin. And there's a lot of research now showing that if we go out early in the morning, that the impact of the sunlight on our eyes has an impact on our ability to release melatonin, which is the hormone in our brain that helps us to go to sleep at night. So again, it's a bit counterintuitive, but if you want to get a good night's sleep, get out early in the day, get some sunlight early in the day, and that will really help. And finally, when do we know, what is a serious mental health concern? If you are wondering, is this normal variation that my child is going through, or should I really be seeking advice? Remember that all symptoms of mental health difficulties are on a continuum in the population. We all worry sometimes. We all have low mood. We all have delusions sometimes. It's very normal to have these ups and downs, particularly in the teenage years. The things that I think are important to think about is, how often do they experience it? And are they able to do things without the distress? If there are some areas of their life where they are, that's a good sign. How severe is it? How much does it really take them down? How easily can they control it? So if you put some strategies in place, are you able to help them manage their mood? And how much distress does it cause? So those are just some things to think about. How often, how severe, how easily can they control it, and how much distress does it cause? Now, if your child is high on all of those measures, then you probably do need to seek some advice and get some help. And obviously, if you think your child is in any kind of risk in terms of hurting themselves, then you really urgently need to seek some help. It's a really tough call, I think, as a parent, managing this. What is normal variation? When do I need to get help? And so really, really good luck with that. And having a teen who's shut down is also really difficult, but just have a look at the tips, take it slowly, and know that with a little tiny bit every day, progress will happen, and the young person, will make some improvements over time. So thanks so much for listening. If you have any questions for Nip in the Bud, please send questions through to us, and we are answering as many letters and emails as we can.